exams and course evaluations and feedback. Okay, we have three objectives for this course. First is at the end of the course, the participant will understand the natural history of diseases and familiar with the concept related to HIV and AIDS. Second, develop a compassionate attitude in looking toward the problem of person living with HIV/AIDS. And the third, participant can contribute to prevent the spread of HIV and AIDS among young people. The course is 2 credit semester unit for participants from University of Indonesia. We will give certificate for those participants who attend at least 10 sessions. The course is 2 days duration, so we have 2 sessions per day. We have 11 sessions and 3 panel discussions, and we have summary and synthesis and final exams. And at the end of the course, we will have the course interactive course feedback. Okay, the session and panel discussion is grouped into 5 issues. First, basic information on HIV/AIDS, where we'll discuss the issues of HIV/AIDS among young adults and the natural history of the diseases. And the second group, the current HIV/AIDS situation, we will discuss EPI situation, global situation, and also EPI situation in the Asia regions. Then we will discuss HIV/AIDS prevention, behavioral preventions, as well as biological preventions. And in group 4, economic and psychosocial impact, we will discuss economic impact and psychosocial impacts. And we also have a panel discussion on some perspective and issues. We have 3 panel discussions, one on national impacts, religious perspectives, and issues and human rights on stigma and discriminations. Okay, this is the rundown of daily schedule. We will start at 9 o'clock, and we have 40-minute lecture with no interruptions, and then we will have 15-minute discussions for session 1, and we move to session 2 with 5-minute breaks. Then at the end of, basically the video conference will last for 2 hours from 9 to 11. Then we will have offline discussions for participants from the University of Indonesia. Okay? For inherent site who want to have offline discussion, this is optional. Okay, so PowerPoint slide, handout, list of references, and daily evaluation form can be downloaded from these sites, www.clr, UE, UI, AC, ID, JDLC, News. We would like you to do a daily evaluation, so please download the form now. Would you? Okay? Okay, questions specific to the issues discussed during the lectures and panel discussion could be sent by email through this link. But this is mainly for participants from University of Indonesia. But those who want to post a question, please do. This is optional. Okay. Okay. Now we will have an online multiple choice exams immediately at the end of the course in June 4. But deadline for submissions, the participant can submit the exam within 2 weeks. So, but the exam is an integrated part of the learning process. Those participants who want to improve their grade can retake the exams. Okay. We will have an online interactive course feedback at the end of the course. It's a plus and delta session. We'll talk about what do you like about the course. It's a plus, and things need to be improved. Okay, basically that is the introductions. We have 5 minutes if you have any clarifications. Please, those who want to clarify any information on the course, please do now. Is there any clarification from the introductions? Otherwise, I will switch to Rosen Wong in Bangkok UNESCO sites for her sessions. Okay?
Okay, if there's no question, so we will move to the next speaker. The next speaker is Mrs. Rosen Wong. Mrs. Rosen Wong is the HIV and AIDS Preventive Education and School Health Officer at UNESCO's Regional Office for Asia and the Pacific. She belongs to the HIV Coordination Adolescent Reproductive and School Health Unit, whose work focus on strengthening the capacity of Ministry of Education in Asia Pacific region to effectively respond to HIV and AIDS epidemic. And second, developing and expanding HIV/AIDS preventive education program and creating HIV and AIDS preventive education tools for learning and teaching. Mrs. Wong also has professional work experience in the international development field within the non-profit, private and public sector. Prior to joining UNESCO, Ms. Wong had worked in the area of community health with the Canadian Red Cross in Central America. So, please, Mrs. Wong, this is your time.
Thank you very much. I'm very pleased to be part of this course. And can everyone hear me well?
Yes, thank you. We hear you very well.
Great. I've been asked to speak this morning about why it's important, why HIV prevention education is important. And I think that in order to do so, it's hard to talk about it without introducing what HIV and AIDS are. So I'd just like to give a brief outline of the presentation. The first part is what is HIV, what is AIDS, how is HIV transmitted, how to prevent HIV, a little bit about HIV and AIDS in Asia and the Pacific to give you an idea of sort of the importance of the issue in this region. What is HIV preventive education from UNESCO's perspective? Why is it important? Why are young people at risk of HIV? And a little bit about our work here at UNESCO and HIV. And finally, the goals of the HIV education goals that we are trying to achieve. Next slide, please. What is HIV? HIV stands for Human Immunodeficiency Virus. It's a virus, which means that we can't actually see it with the human eye. And it's human virus, so that means that it can only infect humans and not other organisms like mosquitoes, for instance, which is commonly a question. The HIV virus stays alive in human cells, blood, semen, vaginal fluids, and breast milk. Next slide, please. Human means that it's something that's transmitted from one person, one human being, to another human being. And immunodeficiency means that this virus breaks down the immune system, makes it very deficient or weak. The human body has difficulty fighting against any diseases from this. And virus means that it's a very tiny particle that infects organisms and causes disease. Next, please. And what is AIDS? So AIDS stands for Acquired Immune Deficiency Syndrome, but it's also commonly referred to as Acquired Immunodeficiency Syndrome, so they mean the same things. And this is important. I'm going to talk about what AIDS is in terms of what happens when the HIV virus comes into the human body, but it's important to know here that just because you have HIV doesn't mean that you have AIDS or that you are going to necessarily develop AIDS. A lot of people living with HIV live with HIV for years before, if ever, developing AIDS. So as HIV comes into the human body, it destroys one's immune system, makes it very, very weak, and so a person living with HIV will start to develop related illnesses. Next slide, please. So when you have a number of these illnesses together, it means that the HIV infection has now started to show signs, and what we call in technical terms is now it's symptomatic, means it has signs. And the symptoms become visible in the body in different forms. And the immune system will then stop functioning. And when your immune system becomes so weak that it stops functioning, then you have AIDS. And so AIDS is the most serious stage in HIV infection, and it's a stage in which your immune system is very, very damaged, or it's deficient and it's not working. Next slide, please. AIDS, so let's break down what AIDS means. AIDS is standing for A for acquired, which means that it's not something that you can get through hereditary disease, through your genes. It happens as a result of an external source, in this case a virus that enters the human body. And secondly, immune deficiency. Immune deficiency means a loss in ability for the immune system to fight against any disease at all. And lastly, why is it called a syndrome? Because it means it's a group of signs and symptoms that come together and give a particular picture of the disease. And it's important to know not every person who has AIDS has the same group of symptoms and signs, so they're different from one person to the other, and so this is why it's a syndrome. Next, please. So now that we know what HIV and AIDS are, it's good to figure out, in this case for all the students here, how is HIV actually transmitted? How does it actually enter into the human body? And there are three main modes of HIV transmission. The first is exposure to infected blood. So that might be sharing needles, or in a healthcare setting, it might be that the blood was contaminated beforehand and has the virus already, and therefore you would get the HIV through blood transfusions. Secondly, it's through unprotected sex, which means here, in particular, vaginal sex and, of course, anal sex as well. And lastly, another way of getting HIV is from a mother who's living with HIV to her infant during either the time that she's pregnant, the time that she gives breast milk to the baby, or while the child is being born or passing through the birth canal. So those are the three main ways of getting HIV, or for HIV to be transmitted. Next, please. And in terms of, I've listed here the 5 ways, of course, the most frequent ways that HIV is transmitted around the world. And I just want to highlight here that these are global, this is global data. So as we all know, in Africa represents the largest numbers of infections around the world. So the data here is somehow more, I guess if the word is biased, but it more applies to the African context overall. And I'm going to just explain that a little bit. So the first is the most frequent form of HIV transmission will be infection during sex between men and women. And the second most frequent way is infection to babies during pregnancy, birth, or breastfeeding. But as I mentioned earlier, this is really more information relating to Africa. So in Asia context, infection to babies during pregnancy, birth, or breastfeeding is not going to be so highly, is not going to be as frequent as in the African case. So it's not as a major concern in this region, at least on the general scale. Thirdly, infections from injecting equipment during drug use. That's the third most frequent way. Fourthly, infection during sex between men. And fifthly, the least frequent is infection in a healthcare setting. As I mentioned earlier, if the health equipment is not sterilized appropriately, or if the blood that's being used in transfusions is already contaminated, then that is a way in which you can get HIV. Next, please. How to prevent HIV. So as I mentioned, those 3 ways of transmission, of course, how to prevent them is very much linked to those 3 ways. People need to be aware of the risk factors for HIV transmission, as I just pointed out, and you should be able to make safe choices in your life and be motivated to do so, and to have access to methods of HIV prevention, which I think other speakers will be going into later on in the course, and HIV testing facilities. I mean, the only way you can prevent HIV as well is if you know that you're living with HIV or you are HIV positive, then you have to be even more cautious about not ensuring that you're not going to pass on the HIV virus to someone else. And lastly, this is the most important point here, is knowledge about how to reduce the risk of HIV is very important. It's critical in HIV prevention. Next, please. So, what are the kinds of knowledge that are needed to prevent? One is here is the ways in which HIV can be spread. And so there's often a misconception. Basically, those 3 ways are the only ways you can get HIV. Sitting next to somebody living with HIV or AIDS is not going to be of any risk for you in terms of getting HIV or being infected. So secondly, knowing which behaviors greatly increase your risk of exposure to HIV is important. And finally, knowing effective methods to remove or reduce these risks for each mode of transmission is also equally important. Next, please. So in Asia and the Pacific, to give you a sense of why UNESCO thinks that HIV prevention education is so important, is let us look at the figures and statistics coming from the region. So this is sort of the most recent up-to-date data that we have. Most of it's coming from UNAIDS and WHO. So we have 4.9 million people with HIV or AIDS in 2007 in this region, and 440,000 new infections in 2007, and 300,000 HIV and AIDS related. And so basically what we're saying is, if by 2020, we don't scale up our prevention efforts or initiatives, there will possibly be 10 million new infections by 2020 in the region. So that's a very significant number if you think about how large some of the countries are in the region. Of course, aside from China and India, who make up a very large share of proportion of new infections or people living with HIV in the region, 10 million is a relatively large number for new infections by that date. So in Asia and the Pacific, most countries face what we would call technically a concentrated HIV epidemic. And what is that? So according to WHO, the World Health Organization, HIV prevalence, if it's a concentrated epidemic, HIV prevalence must be consistently greater than 5% in at least one subpopulation. That's one particular group. and is less than 1% in pregnant women in urban areas. So for most countries in the region, this is the situation. Next slide, please. Now that and lastly, there was a study recently commissioned by the AIDS Commission in Asia, and the report is available now. It has found that 75% of HIV infections among adults and 95% of HIV infections among adolescents are linked to these three behaviors. The first is unsafe sex in the context of the sex industry, sex workers, or clients of sex workers, unsafe sex between men, and lastly, unsafe injecting drug use. So this is a very important finding because basically the UN family has pretty much considered these findings to be very important and are now key in sort of shaping the work that we're doing in the region. And Secretary General Ban Ki-moon has actually supported, or rather endorsed, this report and the findings in it. So we are now going to be focusing our work more around these three risk behaviors. Next, please. So what is HIV preventive education then? I mean, that's the big question here. It is basically several things. It's the knowledge, attitudes, and skills about the scientific aspects of HIV, the medical aspects of HIV, the social and behavioral aspects of HIV. So the social impacts, why people get HIV, it's behavioral as well, all these different things. And it's also not just this group of knowledge, attitudes, and skills, but it's also the transfer of these knowledge and attitudes to young people like yourself, both in non-formal and formal settings. So I just want to clarify, formal settings here refers to formal educational institutions like universities and schools, colleges. Non-formal would tend to look at educational settings that basically any educational setting that is not within those places I just mentioned, the university, the schools, the colleges. And this is important because young people, there are young people who are not actually in schools. Those are out of school youth for whatever reason. They're out of school and they're maybe working instead of, or they don't have the same opportunities to go to school. It is also important to ensure that those young people as well get essential information and attitudes about preventing HIV. And finally, HIV preventive education is about developing what we would call life skills, which I'll explain a little bit, needed to reduce the risk of HIV transmission, alcohol and drug use, and to help young people adopt healthy lifestyles. We've mentioned alcohol and drug use because we think that these are also key issues relating to young people, and they do affect, and I'll talk about that a little bit later, they do affect oftentimes young people's ability to make decisions. I'm talking about alcohol and drug use, and therefore that does sometimes affect or make young people more vulnerable to HIV transmission. Life skills are basically the skills that people need to go through life, and they're coping skills. They're skills such as negotiation skills, communication skills, handling stress. Those are the various things that comprise life skills. Next slide, please. So why is HIV prevention important? I mean, we talked about the statistics that I mentioned earlier in Asia and the Pacific, but maybe on a global scale, it's good to know that, after 30 years since the beginning of the HIV global epidemic, we still have millions of people at risk of infection. So it's a very large problem on the global scale, and it's not going away anytime soon. Many people have little access to information about HIV prevention and are still largely unaware of the risks. Next, please. So why else is it important? Well, there's often misunderstanding about HIV and AIDS and prejudice against people living with HIV, negative attitudes towards those who have died of AIDS and their families and people associated with them. So these negative attitudes and prejudices and misunderstandings create situations where people are less likely going to get treated or tested for HIV because of the consequences. If people feel very afraid, if they know that, you know, someone's going to find out that they're living with HIV, then there's a lot of possible consequences at the community level, how they'll be treated. Maybe they're afraid that they'll be rejected by their community and their families. And so people then don't want to go get tested, or they might suspect they have HIV, or they won't go get treatment, if treatment is available, of course. This is a problem because if you know that you might have HIV, but you don't get the proper information to protect yourself, protect other people around you, then there's a very great chance that you might pass on HIV to someone else. So this is very important. And also, the misunderstanding about HIV is very important because there's been a tendency to associate people living with HIV with those that are bad people, or they only do bad things, and only people like drug users or sex workers get HIV. This is a danger, because if you only think that, then you'll think that you're never at risk of getting HIV, and therefore you don't protect yourself. That's the main thing. So finally, accessible and accurate education about this communicable disease is very essential then in reducing risk behavior and HIV infection. Next, please. Why is it important? Young people, as I mentioned earlier on, 95% of young people in the region get an HIV through the three main risk behaviors I mentioned. One is unprotected sex between men, unsafe sex in the context of the sex work, either sex workers or clients of sex workers, and of course that impacts as well families of the clients of sex workers. And lastly, I mentioned unsafe drug use. So young people engaging in those three risk behaviors are very high risk of HIV infection all around the world. Studies suggest that around 40% of new HIV infections are between those that are 15 years to 24 years of age, which tells us that 2,320 new infections occur every day around the world. I mean, can you imagine? That's every day. That's a very, very high figure. And it's important to prevent HIV because we would like to promote the health and prevent disease of children and youth, and we'd like to foster behavior that reduces risk and lessens the impact of HIV. Next, please. So why are young people, I mean, I've been asked to speak to all of you who are now in university, and why are young people at risk of HIV? That's the question you might be asking me. Because there's still widespread ignorance about HIV, and a lot of people remain uninformed about the most basic facts about HIV and prevention. So young people in general, but in young people I'm talking about specifically, often lack knowledge, skills, and attitudes needed to protect themselves and to make informed decisions about their sexual and reproductive health, about their relationships, drugs, drug use, etc. Next, please. So, and also adolescence. Adolescence is a time of change, physical change and emotional change and experimentation. You're young, you like to try different things, you're curious, and you want to experience different things. So many young people, and this is based on empirical studies and evidence, we are not just making this up. I mean, many young people are sexually active, okay, and they're not practicing safe sex. And many young people are experimenting with recreational drugs and alcohol. And I said earlier, drug use, including alcohol use, will alter a young person's judgment and ability to make rational decisions or healthy decisions for themselves. And so this can lead to risky behavior and unsafe sexual practices, which again makes the risk of HIV infection that much greater. Next, please. So these are all the reasons why UNESCO is working on HIV. So I'm just going to talk about that a little bit. UNESCO is part of what we call the UN Joint Program on HIV and AIDS. I'm sorry, the phone is me. UNESCO is part of the joint UN program on HIV and AIDS, and this is important because the UN family, and so all the UN agencies have come together under the guise of UN reform, and ex-Secretary General Kofi Annan had asked all UN agencies to work on HIV in some way. And so UNESCO is in charge of HIV prevention in educational institutions, and so we focus on education for young people. And basically, every UN agency has its own responsibility. The division of labor has been very clearly defined. So for UNESCO, it's HIV prevention in educational institutions. For UNFPA, it's reproductive and sexual health. For UNICEF, it's HIV for children, pediatric HIV, as well as transmission of HIV from mother to child. I think I'm... Excuse me. Thirdly, UNESCO is responsible for promoting and increasing access to HIV education, school health, and adolescent reproductive and sexual health. And that is basically our mandate all around the world. It's not just Asia and the Pacific. We are partner agencies in many other areas of work, including HIV prevention among men who have sex with men. And so UNESCO is now becoming more and more known for our work with men who have sex with men. And I just want to outline here that men is a very general term in this case. It also encompasses young people, so teenage boys as well. And finally, HIV and AIDS, why we work on it at UNESCO is because it's part of what we call the Millennium Development Goals, and those are universal global goals that countries, member states of the UN have come together and pledged commitment to these goals in the year 2000. And one of the goals in particular relating to HIV is to combat malaria, tuberculosis, and HIV. And lastly, HIV is important for UNESCO because we are trying to achieve the education for all targets. Basically, if children are not in good health, then their learning is compromised, and you need good health to also study, and you need education to sort of promote well-being, so they're kind of interrelated. Next, please. Finally, HIV Education Goals. These are the goals that UNESCO specifically works on. One is to assist in building the capacity of the education sector in Asia Pacific to better respond to HIV and AIDS. And we are working to contribute to a 25% reduction of HIV infection rates among young people globally by 2010. Next, please. And by 2010, we would like to ensure that at least 95% of young people have access to information, education, including peer education, and youth-specific HIV education, and services necessary to develop the life skills required to reduce vulnerability and HIV infection. And finally, to challenge stigma and discrimination towards teachers and children living with HIV and or affected by HIV. So you might be living with HIV, and that's one thing, but if you're affected by HIV, it might mean that somebody in your family, not yourself, is living with HIV or has died of AIDS. And I think here it might be important to just explain briefly what is stigma and discrimination. You know, stigma is sort of the prejudice that people feel, the biases, the negative attitudes people feel towards someone else for reasons, for whatever reason. In this case, of course, living with HIV. And discrimination is the actual action. So the stigma is the thinking, the attitudes, and the discrimination are the actions that people take towards others living with HIV. So those are the things that we're trying to combat. And finally, the last slide, I'd like to invite you to look at our website, because on our website here, www.unescobkk.org/HIV/AIDS, has a lot of different resources here for HIV, and some are in different languages. We're trying to expand the repertoire of HIV teaching and learning materials, so it's not just for teachers, it's also for young people as well. We also provide a service to those looking for specific information and materials on HIV. You may come to that website and request or email their aids@unescobkk.org. You may email for further information if you'd like to get help in finding something. We provide that service. So that's the end of the presentation, and I'd be very welcome to any questions at this time.
Yeah, thank you very much, Ms. Roseanne, for your straight and clear presentation. And now we will invite the students to ask questions to Ms. Roseanne.
Sorry, because it was you, right? I couldn't talk. I was delivering. Okay.
Okay. We start with the University of Indonesia students in Depok. University students in Depok, hello. So do you have any question?
No, I don't have a question. Thank you.
Depok? No? Hello? Depok? Yeah.
Hello.
Yes?
Hello, good morning.
Yeah.
I have one question to Ms. Roseanne about the rule of the UNESCO to prevent HIV, and I just want to confirm that UNESCO rule is mainly in young people, and how about the adult and maybe baby, because the main infection is through sex, mother to baby, and IDU and MSM, but not specifically young people. Thank you.
Okay.
Okay. Actually, in the global, I mentioned in the different types of transmission. One of them was, the second most frequent was mother-to-child transmission, but I also mentioned that wasn't, for Asia and the Pacific, that isn't actually of great concern. The statistics show that isn't. So for us, the most frequent mode of transmission is still sex between men and women, and that's the first answer to the question about why we're not focusing on mother-to-child transmission. The other is, do we only focus on young people? No. We work with teachers, and we develop materials for teachers on how they can better, and when I say teachers, I mean school teachers, university professors, and lecturers, on how they can transfer these attitudes, knowledge, and skills to young people. I mean, at the end of the day, our ultimate beneficiary is the young person. We would like to get them the knowledge and information needed to protect themselves. That's the first. And there was another question, but I think, did I answer everything? Is there anything else that I missed?
Yes, thank you.
Okay, thank you.
Hello, Burita.
Yeah.
Hello, Burita.
Yes.
We are from Erlangga. Yeah, do you hear?
Okay.
Yeah, we are from Erlangga
Yes.
University. Although we can see the presentation, we are still with you. There are 36% here.
Okay, do you have a question?
Yes, I have a
to Ms.
question.
Roseanne?
Yeah, I have a question for Roseanne. As I know, there are two information that we have if we want to give health education. The first one is the age of first sexual contact, and then the second one is the description of sexually transmitted disease. As we know that HIV is categorized as sexually transmitted disease. Is there any other data that we have to know so we can assess when we have to start to give health education? Thank you.
Ms. Rosanne, please.
Yes, I don't have the exact name of the publication, but there is something that UNESCO has produced that talks about when to provide sex education, or rather HIV prevention education. And basically I understand that we promote to start sex education at the earliest possible age, and this has shown that, you know, there's a lot of resistance as well in this region for various very understandable reasons for why you know, why ministries as well as teachers are hesitant to teach about sex and HIV prevention at a very young age, for example in elementary school. But the data has shown us that the earlier you start, actually, the result is that there's a delayed beginning to sexual relationships for those children and young people who have had exposure to sex education, HIV preventive education earlier on. So that's my answer to when is it appropriate. And as far as my experience in the region goes, I believe that we leave the door open for countries to determine that. Because, again, UNESCO is a technical agency. We provide the technical advice, but at the end of the day, it is up to the countries and the member states to decide when is it most appropriate. So we've had different responses. In Central Asia, there's been a very big push to have sex education, HIV education as early as primary school. And in other countries in the region, that has been always lower secondary or high school. So again, it's varying depending on the country context.
Okay, thank you, Ms. Santi. And then the other, Salemba side. Salemba side.
Hello.
Yeah.
Yes. This is Mona. Excuse me. This is Mona from USU, University of Sumatera Utara.
Okay.
Hello.
Yes, please.
Hello. Can you hear me?
Yeah,
Yes,
we can
yes.
hear you.
Okay. Hi, Mrs. Wong. Thank you for your presentation. I want to ask 3 questions basically. Now, the first question goes to the populations of countries. Is there any influence that highly populated countries will tend to have more AIDS cases? That's the first question. Now, the second question goes to, well, you said that a person who is infected by AIDS doesn't necessarily live in AIDS. Yes, and that is true. However, eventually the infected people will get AIDS. If the infected people will get AIDS, it won't they? As AIDS is the last stage, basically. And the third question, and this is the uncommon questions. One of them, is there any influence? Will we be affected if we then when we kiss and there is a blood in our mouth, then will we be affected by this AIDS? Thank you.
Okay, Ms. Rosanne, there's 3 questions from University of Sumatera Utara.
Okay. I got the first 2 questions, and the third one I didn't get clearly. So let me answer the first 2, and then may you please kindly repeat the third one. It was a bit foggy. The first question is whether population has been linked to high population has been linked to higher cases of HIV. I think that in essence, I don't think that's been proven in terms of, you know, you have a higher number of people living in a country and you have higher rates of infection. But as shown by the cases of China and India, because they have higher numbers of people, the rates of infection may not be higher, But of course, the absolute number of people living with HIV would be higher simply because there's more of them. So the answer is the rate of infection has not been proven to be higher in a more populous country, but of course the absolute numbers of people infected would be higher just because there's more people living there, if that makes any sense to you. And secondly, the question was those living with HIV, yes, they don't always get AIDS. And there have been so many cases. This is what we're advocating for as well in the UN system, not just UNESCO, is that people should have free access to what they call antiretroviral therapy, which I think you will hear about by later speakers. These are a group of drugs, yes, that when used in combination can help to control the HIV virus in the body. So basically, it doesn't allow the immune system to get too weak. And basically, if you have that access, you can live for several years. In fact, there are people who've lived in more than 10, 15 years using these antiretroviral drugs and being able to live very productive lives. And so in Thailand also, there is an orphanage here for children living with HIV who are having free access to antiretroviral drugs, and those children normally, and I guess in most cases, they would have died or have gotten HIV, because it's actually, for children who get HIV, it's more, so their immune systems are already a lot weaker earlier on, especially if they're infants, so the chances that they will get progress to AIDS is a little bit higher than adults. But those children have been able to go to school and continue and graduate from, secondary school and move on. So there's been proof of that. Just want to say that around the world, I understand that developing countries, only about 24% of people who need antiretroviral drugs are getting them. And so Thailand is the one exception in the region here in Asia who's providing access at a very low cost or practically free to people who are living with HIV. And could you kindly repeat the third question, please?
Thank you for your question. Thank you for the answer. I think the questions might sound very uncommon, but this is just out of curiosity. I want to ask whether kissing, when you, for example, there's a case when people are kissing and there is a bleeding over there. Is there any possibility that AIDS will be transformed that way? Thank you.
I think in general, kissing as an activity, because you're not actually exchanging infected blood or anything like that. But let's just imagine if somebody had HIV and you would both have to, like the recipient, the person who doesn't have HIV would technically need to have coincidentally a cut in their mouth, open wound or something, whereby the exchange of fluids or infected blood would happen. The chances of that are very slim anyway. You'd have to imagine two people, one with HIV and the other person with an infected wound in their mouth, engaging in kissing. I think that the chances of that are very, very low. In fact, there is a scale, and we have it on our website. You can go into I would invite you to look at it. It is called if you want to note this down, it's called the Building Knowledge About HIV and AIDS electronic course. Okay, that's actually for teachers, but when you go inside there, you will see a matrix, a list rather, of behaviors defined by low risk, medium risk, and high risk. And I think kissing is on the low risk end of it. So that's just an answer for you.
Thank you very much, Mrs. Wong.
Okay, I think the last question is very important for the young people, I think, yeah? Okay, there's a lot of sites that haven't asked any question. Do you still have question? I will invite one by one. Please, I will invite one. Wait for, I will call one by one because there's a technical problem.
Hello?
Yeah. Okay.
Hello? Hello? I'm Hasanuddin University. Nice to meet you, Mrs. Wong. Could you tell me, please, how to practice prevention HIV/AIDS of infants to mother and child, and what kind of way about that? Thank you very much.
Sorry, I'm sorry, I didn't get it clearly. Could you kindly repeat that again? My apologies.
Yeah, it's a transmission from mother and child. Yeah, how about that? Yeah.
Okay, the question is how it happens?
How to practice prevention?
Oh, prevention, sorry.
Prevention HIV/AIDS
yes.
for mother and child. Yes.
Yes. Well, I guess there's two things. I guess first is, I just wanted to say this, by the way. I didn't actually mention it earlier. But mothers living with HIV, I mentioned there's 3 ways for the mother to pass the HIV virus to the baby, to the infant. But it also has been shown that just because you're living with HIV as a mother doesn't mean that the baby will get HIV. And there's a lot of cases where the baby is born and they're free of HIV. So there's that possibility. It's not necessarily because you're living with HIV and your mother that the baby will definitely 100% get HIV. I believe the transmission rate is roughly, I don't have it here, but I believe it's around, don't quote me, 35%, I believe. So one of the things, of course, is if you are a mother and you believe that you are living with HIV, one way to prevent transmission would be to, of course, take antiretroviral drugs, which is what some women are doing, if they can get access to these drugs. And then they do say that if possible, and this is not very possible in many situations, is to not breastfeed, to provide other forms of milk that are not contaminated with HIV to the infant, if possible. So that might be different types of milk formulas. There's been other cases of other people's breast milk that's not contaminated if you know it's safe. There have been different options for women. Those are the 2 that I can think of, but antiretroviral drugs is really key. That's all.
Okay.
Is that clear now?
Yeah. Okay, thank you very much. Yeah, I know that there's a lot of sites that have a lot of questions too, but we should move on the next session. But don't worry, because you can write the question to the www.cml.ui.ac.id. Yeah, for the students that you have a lot of questions, you can write it there. Thank you very much, Ms. Roseanne, and then we will move to the next session. So we will have break for 5 minutes to prepare the second session. Thank you.
Break. Oke, bagi side lain akan break selama 5 menit, tapi mohon sekali lagi untuk di mute mic-nya supaya tidak terjadi feedback. Ya, dan satu lagi, mohon nanti kalau ada pertanyaan sesudah presentasi, tunggu moderator memanggil side-nya satu persatu. Jadi kita tidak berebutan untuk menanyakan. Jadi nanti akan dipanggil satu persatu oleh moderator. Terima kasih.
Pak, Bapak. Halo.
Ya.
Pak, kita dari UNER. Ini ya, bisa nggak kalau dalam hari ini dari tadi kita sudah ikut mulai jam 9. Tapi kita nggak bisa lihat, nggak bisa ya hari ini kita bisa lihat untuk yang sesi kedua. Kita bisa dengar, tapi kita nggak bisa lihat presentasinya.
Nggak bisa lihat?
Iya, presentasinya kita nggak bisa lihat, tapi kita bisa dengar apa yang dipresentasikan.
Maaf Bu, sekarang yang tampil di layar Erlangga apa?
Nggak ada.
Kosong ya?
Dari tadi, iya dari tadi kosong.
Ya, halo, maaf, ini saya teknisi ininya, MCU-nya. Jadi di MCU itu status di Airlangga itu dari tadi apa namanya secondary, artinya secondary itu ada video protokol yang nggak sinkron antara MCU sama yang perangkat yang ada di apa namanya Airlangga. Dari tadi mau saya putus, kemudian coba saya call lagi, seperti itu lagi, akhirnya saya biarin karena lebih baik kalau menurut saya bisa dengar suaranya dulu gitu. Mungkin ini sesi istirahat, mungkin saya disconnect dulu, nanti saya sambungkan lagi, saya coba lagi video protokolnya.
Oh gitu ya. Tapi nanti diusahakan bisa lihat ya Pak ya.
Iya, mudah-mudahan bisa, Bu.
Iya. Terima kasih Pak.
Sama-sama, Bu.
Mat, akhirnya gimana status MCU Depok, Mat?
Halo Depok, halo
Good morning
Pak Doni.
everybody.
Maaf,
Yeah.
sebentar Bu. Cuman mau ngasih tahu ini site yang connect ITTC Depok, yang lokalnya itu ITTC Depok, terus kemudian Salemba, terus Undip, terus Airlangga, terus Unhas, terus Unut sama USU. Kalau yang internasionalnya Bangkok, Keio sama Malaysia yang sudah tersambung. Ya, silakan.
Oke, Mat, Terima kasih, Mat.
Iya, Pak.
Untuk site-site yang ada di Indonesia kita sebentar lagi akan mulai lagi. Tapi saya mohon, saya mau cek dulu. Airlangga, apa sudah bisa melihat kita?
Belum Pak, belum bisa lihat, tapi dengar suara.
Oke. Tolong Ibu di-mute juga ya, dimatiin dulu ya mic-nya. Mic-nya dimatiin. Oke, terima kasih. Mat, itu Airlangga belum bisa lihat tuh. Selamat. Oke, kita akan segera mulai dengan sesi kedua yang akan dibawakan oleh Ibu Moderator. Terima kasih.
Okay, good morning everyone. It's a pleasure for me to have the opportunity to be the moderator of this session. This session, we will have the very good opportunity to meet with Professor Samsul Rizal Jauzi. He is the professor from the Medical School, University of Indonesia. He has a very long experience working with HIV and AIDS, especially in Indonesia. He has developed Pelita Ilmu, an NGO in Indonesia actively helping people with HIV AIDS. And now he is an important member of the working group on AIDS at the School of Medicine, University of Indonesia, and Cipto Mangunkusumo National Hospital. Okay, Professor Samsul Rizal, you have your time to deliver your lecture on natural history of HIV and AIDS.
Thank you, Ibu. It's a pleasure for me to discuss with you all about natural history of human immunodeficiency virus. We will call it later HIV. I'm a clinician, but I will try to discuss the topic, the natural history of HIV infections, with you as simple as possible by avoiding complicated medical concepts and terms. Okay, next slide. Next slide, please. Yeah. Page down. Yeah. Thank you. So this is the overview of our discussions. Problem of HIV infection in the regions. Mrs. Song already mentioned that, and also in Indonesia. And we'll later on know the cause of HIV infection. It means the virus itself. And how this HIV enters our body and consequences of HIV infections to our body. Of course, also our body response, and we'll also discuss about the treatment. But the most important also, how is the future of people living with HIV and summary. As mentioned already by Mrs. Wong, that our regions, Asia Pacific, also have a problem with HIV. Around 5 million living with HIV in Asia Pacific regions. And we know that from this global map of UNAIDS, that most of the people living with HIV stay at the developing countries. So that is the problem for most of developing countries also in our region. Slide. I will inform about HIV/AIDS in Indonesia. Is the first case reported by Professor Zubairi in 1986. But now in our hospital, around 3,000 cases recorded. But in Indonesia, all of the Indonesian cases is estimated around 270,000. However, recorded cases is still around 20,000. What does it mean? It means a lot of people living with HIV, they don't know the status of his or her HIV, And because they don't know, they don't have access to treatment, and also they don't care about the preventions. Slide. Indonesia, according to UNAIDS in 2007, is one of the countries in Asia where HIV cases grows rapidly, maybe the fastest in Asia. Slide. Now, what is the cause of infection? This virus, founded by Lou Montagnier in France and Robert Gallo in USA in the same year, 1984. And this virus enter our body and multiply in one cell called lymphocyte, that is a white blood cell, and we will later on code this lymphocyte name with CD4. And when this virus enter the lymphocyte, they will multiply there. More new virus will arise and will enter another lymphocyte. Let's see in the picture. Slide, please. This is the virus, very beautiful virus, but very dangerous one. We will see that at the outer one there is envelope, and in the inner side there is nucleus, and this virus will fusion with lymphocytes, right? But how this virus enter our body? Mrs. Wong already mentioned that it could be by unsafe sexual relations, whether man to man or man to woman, sharing needle, usually used by intravenous drug users. Also, don't forget transmission from HIV pregnant woman to their child. The risk of transmission from HIV pregnant woman to their child is around 35% in developing countries. And also, actually, blood transfusion. And blood transfusion, the risk is very, very high, around 90%. But fortunately, in many countries in our regions, blood transfusions already screened for HIV, and if it's positive, they will be not used as the transfusions. So in Indonesia, blood transfusion already screened in 1992. So it's a long time ago. So please again remember that this virus enter our body through sexual relation, sharing needle, transmission from HIV pregnant woman to their child, and blood transfusion, because it's already screened, maybe not important anymore. Now the most important is sexual and sharing needle. But if many of our pregnant women also positive, the problem of child infected by HIV will be also arise. Slide. So HIV will multiply in the lymphocyte, and please remember lymphocyte is one of the cell of our blood cell. There is a red blood cell and white blood cell, and lymphocyte is our white blood cell, which is responsible for our immune system. Right? So this is the picture. We have the virus. Can you recognize that? The big one on the left, upper left. But if they fusion to the lymphocyte you see with the T cell is lymphocyte, or also we call it CD4. So if they have the fusions, the inner part of the virus will inject it to the lymphocyte, and they will integrate it to DNA of the lymphocyte, and after that they will multiply, and you will see at the upper right of the picture a lot of new viral coming from this process. So the viral will multiply and many new viral we will have, but the lymphocyte itself will die or lysis. So the viral will increase, but the lymphocyte, which is CD4 lymphocyte or CD4 only we call it, will down, because many of CD4 infected by viral and used as the place where the viral multiply, and they will die after that. Right? I hope you can see this graph. The red one is the viral numbers, or we call it viral load. So when the viral enter our body, multiply in the CD4, they will increase to the peak. Yes, that is the peak. But our body system will destroy the viral, so they will go down until one point, we call it set point, the equilibrium between the viral multiplication and destroy of the viral. And this equilibrium year by year is like that until at the end they will increase again, and at the end of the disease the viral load is very high. That is the viral. How about CD4? CD4 is the green one, please. Is high from the beginning because it's destroyed by viral, they will go down, and because our body defense a little bit increase, but gradually they will down until a critical number, that is 200. Why 200 is a critical number? Because if CD4 is below 200, our body is easy to be infected by opportunistic infection. So as the consequences of the HIV infection, HIV enter our body, viral load is increased, but down again, and the later state of the disease will increase again, and CD4 gradually will decrease. Right? And CD4 is indicator for opportunistic infections. Our CD4 number in Indonesia is 410 to 1,500. If the CD4 around 500, there are some infection could come, but if it's below 200, more infection will come, and if it's below 50 at the right side, very serious infection could also arise. Right? So, what is the consequences when HIV enter our body? Number of virus increase because this viral multiply in the lymphocyte. Number of lymphocyte or CD4 decrease because this lymphocyte will die after that. Our body response is actually still working, but it's only adequate at early stage of HIV infections. If our CD4 is low, say below 200, the response is not adequate anymore. And don't forget, why person with HIV death is because of opportunistic infection and cancer related. So it's not directly by HIV, but because HIV make the CD4 low, our body system is not enough fight the infection or cancer, so there will be opportunistic infection or cancer-related disease which will cause the death. Slide. Again, just to remind you that CD4 is lower gradually until the significant number is 200, and if 200, a lot of infection could occur, and also some cancer-related HIV also could occur. Slide. So, if we try to make a stage of infections in the early periods, 2-4 weeks, there is what we call primary infections. Primary infection is infection because of HIV in the early stage. It's like influenza symptoms, so high fever, muscle pain for 2 until 4 weeks, but later on they will disappear. After these primary infections, there is no symptom for a long time. We call it clinical latency, 5 to 8 years. So the person is healthy, but actually in his or her body there is HIV. This clinical latency will have a symptoms or syndromes after CD4 less than 200, and we call it AIDS. So again, AIDS is HIV infection with symptoms usually from opportunistic infection, or AIDS may be also without symptom but CD4 already below 200. Please remember that normal CD4 is 410 until 1,500 in adults. What happens if person already in AIDS stage? Usually without treatment, in 6 months to 2 years, he or she will die. So, if no intervention, no treatment, people infected with HIV mostly will go to AIDS stage, and if it AIDS stage, there will be just short period, 6 months to 2 years, they will die. Fortunately, right, we have body response, of course, but our body response cannot eradicate HIV in our body. So gradually CD4 will go down, and if below 200, opportunistic infection or cancer-related disease may occur. Slide. How is the clinical situation in our regions? Mostly people diagnosed with HIV with CD4 less than 100. It means it's already at advanced stage. Maybe they already have opportunity